Diabetes is a chronic health condition that affects millions of people worldwide. It occurs when your blood sugar, also called blood glucose, is too high, which can lead to various health issues. Blood glucose is your main source of energy, and it comes from the food you eat, especially carbohydrates. Insulin, a hormone made by the pancreas, helps glucose get into your cells to be used for energy. Without insulin, glucose can't enter the cells. Sometimes your body doesn't make enough or any insulin. Other times your body doesn't use insulin well, a condition known as insulin resistance. When this happens, glucose then stays in your blood and doesn't reach your cells, leading to high blood sugar levels. Having too much glucose in your blood can cause serious health problems, including heart disease, nerve damage, and kidney issues. Although diabetes has no cure, you can take steps to manage your diabetes and stay healthy through medication, diet, and exercise. Sometimes people refer to diabetes as sugar. It is a lifelong condition that can affect anyone at any age, regardless of lifestyle. There are different types of diabetes, including type 1, type 2, and gestational diabetes, but all types are serious and require proper management. Knowing the basics about diabetes can help you understand your risk and manage the condition if you have it. Education is key to effective management. Let's explore more about the types of diabetes and how they differ, so you can be better prepared to handle this condition. There are two main types of diabetes, type 1 and type 2. Both types affect how your body regulates blood sugar, but they do so in different ways. Type 1 diabetes is an autoimmune condition. Your body attacks the insulin-producing cells in the pancreas, which are crucial for regulating blood sugar levels. This means people with type 1 diabetes do not produce insulin. They need to take insulin every day to stay alive. Insulin injections or an insulin pump are common methods of managing this condition. This type usually develops in children and young adults, but it can appear at any age. Early diagnosis and treatment are essential for managing type 1 diabetes effectively. Type 2 diabetes is more common. In this type, your body doesn't use insulin properly, a condition known as insulin resistance. This is called insulin resistance. At first, the pancreas makes extra insulin to make up for it, but this compensation doesn't last forever. But over time, it can't keep up and can't make enough insulin to keep your blood glucose at normal levels. This leads to elevated blood sugar levels, which can cause various health issues. This type of diabetes often develops in people over 45, but it is becoming more common in younger adults, teens, and children due to lifestyle factors. Both types of diabetes can lead to high blood sugar levels, but they do so in different ways. Understanding these differences is crucial for effective management. Managing diabetes effectively depends on understanding which type you have. This helps in choosing the right treatment and lifestyle changes, such as diet, exercise, and medication, tailored to your specific needs. Symptoms of diabetes can vary. Some people have symptoms that are so mild they go unnoticed. Common symptoms of diabetes include increased thirst, frequent urination, and extreme hunger. You might also feel very tired or have blurry vision. Some people lose weight without trying. Another symptom is slow healing sores or frequent infections. People with type 1 diabetes may have nausea, vomiting, or stomach pains. Type 2 diabetes symptoms may develop more slowly. Sometimes people with type 2 diabetes have symptoms that are mistaken for other conditions. Recognizing these signs is important for getting a timely diagnosis and starting treatment. If you experience any of these symptoms, it's important to visit a healthcare provider. Early detection can prevent serious complications. To diagnose diabetes, doctors use several tests to determine your blood glucose levels and overall health. The most common test is the A1C test, which provides a comprehensive view of your average blood glucose levels. This test measures your average blood glucose levels over the past 3 months, giving a long-term perspective. An A1C level of 6.5% or higher on 2 separate tests indicates diabetes, confirming the diagnosis. Another important test is the fasting plasma glucose (FPG) test, which is often used in conjunction with the A1C test. This test measures your blood glucose after you have not eaten for at least 8 hours, ensuring accurate results. A fasting blood glucose level of 126 mg/dL or higher means you have diabetes, indicating the need for further management. The oral glucose tolerance test, OGTT, is another option, often used to confirm diabetes. For this test, your blood glucose is checked before and 2 hours after you drink a special sweet drink, monitoring your body's response. A blood glucose level of 200 mg/dL or higher 2 hours after drinking the liquid indicates diabetes, confirming the diagnosis. Sometimes a random plasma glucose test is used, especially in emergency situations. This test can be done at any time of the day, providing flexibility for patients. A blood glucose level of 200 mg/dL or higher, along with diabetes symptoms, indicates diabetes, necessitating immediate attention. Getting tested is the first step in managing diabetes effectively, allowing for timely intervention and better health outcomes. Section 5. Treatment options for diabetes. Managing diabetes involves a combination of lifestyle changes and medication. For type 1 diabetes, insulin therapy is essential. People with type 1 diabetes must take insulin injections or use an insulin pump. Insulin helps to keep blood glucose levels in the normal range. For type 2 diabetes, treatment often starts with lifestyle changes. Eating a healthy diet and getting regular exercise can help. Medications may also be necessary. These can include metformin, sulfonylureas, and DPP-4 inhibitors. Some people with type 2 diabetes may also need insulin. Regular monitoring of blood glucose levels is important for both types of diabetes. Keeping track of your levels can help you manage your condition and avoid complications. Your healthcare provider will help you create a treatment plan that works best for you. Section 6. Importance of lifestyle changes. Lifestyle changes are crucial in managing diabetes. Eating a balanced diet can help control your blood sugar levels. Focus on eating plenty of fruits, vegetables, and whole grains. Avoid sugary drinks and limit foods high in fat and sugar. Regular exercise is also important. Aim for at least 30 minutes of moderate physical activity most days of the week. Exercise helps your body use insulin more efficiently. It can also help you maintain a healthy weight and reduce stress. Monitoring your blood sugar levels regularly can help you understand how different foods and activities affect your diabetes. Making these lifestyle changes can greatly improve your quality of life and reduce the risk of complications. Section 7. Prevalence and impact of diabetes. Diabetes is a major public health concern worldwide. According to the World Health Organization, over 422 million people have diabetes globally. In the United States, the Centers for Disease Control and Prevention reports that more than 34 million Americans have diabetes. This includes about 7.3 million people who are undiagnosed. Type 2 diabetes is the most common form, accounting for about 90 to 95% of all diabetes cases. The prevalence of diabetes is increasing, especially in low and middle income countries. The rising numbers are linked to an increase in risk factors such as obesity and physical inactivity. Diabetes can lead to serious health complications if not managed properly. These include heart disease, stroke, kidney disease, and nerve damage. Understanding the impact of diabetes can help motivate individuals and communities to take action in managing and preventing the condition. Section 8. Tips for living well with diabetes. Living well with diabetes requires ongoing management. Here are some tips to help you maintain a healthy lifestyle. First, stay informed about your condition. Learn as much as you can about diabetes and how to manage it. Knowledge is power. Second, follow a healthy diet. Focus on eating a variety of nutrient-rich foods. Limit your intake of processed foods and sugary snacks. Third, stay active. Regular physical activity can help control your blood sugar levels and improve your overall health. Fourth, monitor your blood sugar levels regularly. Keep track of your readings and share them with your healthcare provider. This can help you make informed decisions about your treatment plan. Finally, don't hesitate to seek support. Join a diabetes support group or talk to a counselor if you need help managing the emotional aspects of diabetes. Living with diabetes can be challenging, but with the right tools and support, you can lead a healthy and fulfilling life.